welcome back to My Brown Physio. I am Dr. Neha Singh. So today in this video we're gonna see final year BPT important topics of the orthopedic subjects. So whatever are the highlighted topics, they are the very important topics and very frequently asked in the university examination. So let's see. So seeing for the 15 marks question. So first question is periarthritis of the shoulder. So do remember guys, in the examination they will ask using the different names of the same condition, as the very common name for this condition is frozen shoulder. Then also over here they have mentioned the site. Then for the 15 marks, or even this question can be asked for the 5 marks, they can either ask for the assessment or just for the management, or else they can ask for the both. Then another question for the 15 marks is spondylolysis. They can ask for the cervical or lumbar. Now looking for the 25 marks question, the important topics are thoracic outlet syndrome. Then again over here you can see radial nerve injury, which is not an important questions, but giving you an example that for the same condition they can use different names such as wrist drop, osteoporosis, then congenital talipes equinovarus. Then seeing for the 15 marks question, Colles fracture is an important topic. Again over here they have mentioned the site. Do notice guys, over here they have just asked conservatively. So look in the question that either they have asked for the conservatively or the surgical, and write accordingly. Then ankylospondylitis. Then for the 5 marks question, TA rupture. As I said before that they can ask using different names of the same condition, so do remember that, or else they can also use the short forms. As for the tendon Achilles rupture, they have used the TA as a short form. Then the stump management. Stump management means after an amputation, be it an elbow amputation or the below knee or the above knee amputation, what the care we take as a physiotherapy point of view, that you have to write in the stump management. Then OA knee, Dequarian disease, RA. As RA is an important topic, so you do have to read each and everything. As over here for the 5 marks they have just asked for the deformities in the hand. So do remember, as in RA deformities in the foot, hand are very common. So you do have to remember what are the deformities. Then again over here you can see in the second question paper they have asked for the Colles fracture, and again over here they have mentioned conservatively management and to write the complication. I am also giving you a brief or the review how they can ask you the questions in which pattern. Then again over here you can see the left shoulder periarthritis. In previous question paper over here it was right and over here it is left. Then mallet finger, thoracic outlet syndrome, spondylolisthesis. Then guys, do not get confused between losis, lysis and listhesis. Do remember the difference of all these three. Then ACL reconstruction. This is the most important topic. Then over here you can see they have asked the special test for ACL injury, which we usually learn in the 3rd year. Then over here they have written the rehab protocol. Then rehab protocol is another word for the management, so do not get confused even in this. They can either use the word management or the rehab protocol. Then TKR and THR again are the important topic for the 15 marks. Then for the 5 marks, patella fracture, OA knee, again it got repeated in the second paper. Ankylospondylitis, in previous paper it was asked for 15 marks and over here it is asked for 5 marks. Plantar fasciitis, again over you can see stump management is asked, and over here they have mentioned for below knee amputation. So like this way only they will mention, like for particular so and so amputation what will be the management. For example, if they will just ask this stump management, then you have to write generalized management, that you will do this strengthening, then you will do the care so that there won't be any moisture and all. For below knee amputation you have to write that patient should be in the extension so that the stump do not get inflection position. Then leg should be abducted so that it do not get adapted to the adducted structure. Then strengthening you will do so that if you are planning to go for a prosthesis, the rehab can be sooner. So all this you have to mention. Then over here again the fracture question is supracondylar fracture of humerus, then congenital dislocation of hip. Then this is the sport injury question. Even in further question papers you will see many questions asked in the sport injury topic, either strain, sprain or generalized sport injury. Then Hallus valgus, RSD, sport injuries. Okay, over here only they have asked to classify the sport injury. Then TKR, over here they have mentioned the right side, and they have also mentioned the day, the post-op day. Then over here you have to write the assessment and treatment for the same, that is management. They can either ask to write the rehab protocol. All these are the same, either the management, rehab protocol or the treatment. Then osteoporosis. Then for the 5 marks, PIVD, then dequarian. Again, see, look over here, they have used the short form. Then intratrochanteric fracture of left side. Whenever you are writing the management or the assessment, you have to focus of which side they have mentioned over there, write accordingly in your paper. Then again, total hip replacement on right side due to fracture neck of femur. Why this is necessary? Because over here if you will see, assessment is mentioned and THR basically is done due to this reason, so you have to mention that in assessment. Then again, Colles fracture, then site is mentioned. And if you will see over here, they have also mentioned the patient's age. This is important because, as you know, in older people, the whenever any fracture is there, they do take time to their bone is like fragile and they do take time to heal, and sometimes the fracture do not get joined well. So you know about the names like malunion, non-union, so such things do happen. So you have to also plan the treatment protocol for like focusing by the age of the patient. Then VIC, that is Volkmann ischemic contracture, then rheumatic disease, then congenital dislocation of hip. In previous question paper, they have used CDH as the short form for the congenital dislocation of the hip. Again, ACL injury. Over here they have asked you to write assessment and management. Again, over here they have asked you to write according to the age and also according to the profession of the patient, that is of the athlete, and they have also mentioned the grade. So you do have to focus on all these things. Then transtibial amputation, you have to remember the other name for the amputation, that for the above knee amputation what is the other name, then the below knee amputation what is the name, then for the upper limb amputation what are the other names. Then spondylolisthesis for the 5 marks, birth disease, surgical neck of humerus fracture, osteomyelitis, subacromial bursitis. All these are for the 5 marks. Then again, RA, if you will see over here, they have asked to write the assessment and management of the 35-year-old female with the deformities so and so. And also they have written that the patient has a bilateral knee pain with the associated polyarthritis. So the patient has the condition with some deformity also associated something bilaterally. So you have to remember what you will write in the management, focusing in all these things. Okay, then TKR, then low back pain. Over here you will see you just have to write management of a non-specific low back pain. Okay, then CTEV, treated conservatively of a 6-year-old. If you have read the topic CTEV, you will know, like, since the child is born, what are the protocols followed to do the correction of it. But over here the important factor is the child is 6-year-old and you have to treat conservatively, not surgically, so do write accordingly. Then tennis elbow. Then again the question stump edema is repeated. Then fracture of patella, OA knee. Then fracture of shaft of femur. Over here they have also mentioned that patient has undergone ORIS, that is open reduction internal fixation. So you have to write and focus on the management as a surgical point of view. Okay, then assessment and management of 22-year-old man having ACL and MCL injury, left knee while playing football and treated conservatively. So over here there are the two ligament injury, that is ACL and MCL. Then for 5 marks, plantar fasciitis, frozen shoulder, then Colles fracture, PIVD. If you will see till now, the highlighted questions are the repeated questions. Then again, ankylospondylitis. If you want to know how these important topics questions are asked, you can just pause the video and read the question. You will get an idea like how are the questions asked and how you will frame an answer. Then again, tendo Achilles rupture. Previously it was asked for 5 marks. Over here they have asked for 15 marks. Then capsular pattern in shoulder joint. Then Colles fracture. if you will see the important questions, for example, there is the introduction in an important question, important topic, then the clinical features, the cause, the mechanism of injury. Either they can ask all this for 15 marks, or either they can ask the individual topic question for the 5 marks. So you have to read the important topics in a very detailed manner. Then again, THR, mid shaft femur fracture, rotator cuff muscle of shoulder joint, you just have to describe, so just know all the rotator cuff muscle. Then RA, TKR, then wrist drop. As you can see in first question paper, I do have said to you that they can ask you using the different like same condition using the different name. Then over here they have asked a wrist drop for the radial nerve injury. Then soft tissue injury, that is sprain and strain. Then tennis elbow. See over here they have mentioned the both name for the same condition, that is tennis elbow or the lateral epicondylitis, osteomyelitis, total knee replacement, sprain and strain, prevention of sport injury, arthrodesis, fracture of shaft femur, shoulder dislocation, spondylolysis, frozen shoulder, amputation in a generalized of a lower limb, then Wryneck or torticollis, then below-knee amputation, patella fracture, plantar fasciitis, subacromial bursitis, avascular necrosis of right hip. So over here they can also mention AVN, or they can combine this with the THR. So you do have to remember this. Over here as you see they have written hemiarthroplasty, that means they have done THR in the type of hemiarthroplastic. Then low back pain, then VIC, workman's ischemic contracture, rheumatoid arthritis, central dislocation of hip, periarthritis, dislocation of shoulder dislocation, total knee replacement, amputation, again VIC, wrist drop, POTS fracture, PIVD, lumbar spondylosis. So over here you can see in the same 15 marks question they have asked for the two different topics. Then RA, torticollis, plantar fasciitis, Perth disease, mallet finger, osteoporosis, ankylosing spondylitis, D quarian, dislocation of shoulder. Then over they have also mentioned the which dislocation is anterior, posterior or inferior. Then supracondylar fracture of humerus. Then over here you can see humerus fracture is asked but for the proximal. Then THR, patella fracture, dislocation of hip. Again over here they have mentioned which dislocation, that is posterior. So write the management accordingly. Calcaneal fracture, fracture neck of femur, fracture shaft of tibia and fibula, ACL injury, rotator cuff injury, PIVD, arthrodesis, torticollis, tennis elbow, Colles fracture, Perth disease. You will see that there are certain topics which you will get to know by now, by this time of the video, that these are the following questions which are very repeated. For example, frozen shoulder, then THR, TKR, then ACL injury, then Colles fracture, and that too for 15 marks and 5 marks. These are the questions which are asked for both. So it is very easy. Ortho is very easy, so do not stress about it. Osteomyelitis, poliomyelitis, low back ache or low back pain, then below knee amputation. See again over here they have written the short form, so do not be confused like what is BK now. It is just the short form of below knee amputation. Fracture neck of femur, posterior dislocation of hip, Perth disease, Perth fracture, Colles fracture, dislocation of shoulder, supracondylar fracture, fracture shaft of humerus, myositis ossification, RST, hallux valgus, VIC, then impingement shoulder, then talus fracture, tendinitis. See over here I have also mentioned what you will give the PT management, then ACL reconstruction, then Barton's fracture, stress fracture, frozen shoulder, supracondylar fracture, Goldfuss elbow, CTEV, fracture neck, femur neck fracture, below knee amputation, THR, patellofemoral dysfunction, plantar fasciitis, metatarsalgia, genu valgum, spondylolisthesis. Over here they have asked to describe the grades, so do know the grades. Neck of humerus fracture, osteoporosis, osteomyelitis, torticollis, and that too they have again mentioned the side, hallux valgus, PIVD, low back pain, CDH, congenital dislocation of hip. Then frozen shoulder, over here they have asked you the stages. Then sports injury, redislocation of the shoulder. Then again shoulder dislocation, mentioning the ear. Then shaft of tibia fracture, sports injury, sprain and strain, again sports injury, OA of knee, PIVD, patella fracture. That's it for this video. If you do have any query or any question, do let me know in the comment section. Thank you. See you in my next video.